ask you about the experience of innovation. I suspect many people who aren't involved in trying to innovate at the forefront of a field might not know what the experience is like. How predictable is it? How frustrating is it? Is the experience like this, going up and up and up? Or is the experience like that, sometimes like that? What's it like to try to take on the kind of problems you tackle? What are the real challenges involved? Maybe I'll start with you, Katarina.
I would say it's definitely not a predictable pattern in any way. I think that there's periods when you feel, usually for the most part, you feel like you know very little. There's periods when you feel like you truly don't understand the problem or really don't know much about it. So then you really have to build up your knowledge. And then there's times when things that you're trying work out, and then you get a really big high of, this may actually work. But I think what sustains this whole thing is the enthusiasm and excitement about being possibly able to make a difference in patients' lives. So there's definitely a lot of ups and downs, but throughout the baseline is this excitement about the opportunity to try and help patients. That has been like the experience for me, at least.
Kathy, for you, you've had a long effort, because you're talking about therapeutics that face even greater challenges than devices, perhaps. How do you sustain yourself when things don't work out, when you have negative findings? And how do you get back on the horse and make things work?
A lot of what we're seeing right now, the excitement in immunotherapy, is an example of delayed gratification, because this has been a very long time in coming. I think that what sustains one is that as a guiding principle, there's a sense of certainty that it must be, and that it's the right path that one has to take, acknowledging that it's going to be hard. But that is what kind of pushes you, knowing that it should be, and therefore it could be. We always get a lot of fuel and motivation from the examples of our patients, and there are plenty of examples in the human clinical experience, enough signals that tell us it should be true. And those are the kind of guiding lights that tell us that we are compelled to go in a certain direction, albeit with a lot of obstacles and barriers in the way.
So Victor, when you try to develop these technologies, what challenges have you confronted? How much of this worked the first time, and how long did it take to get it to work at all?
So nothing ever works on the first time. But the key is trying and trying again. And not only trying again in isolation, but really bringing together a community of people around solving a problem. Scientists, engineers, oncologists, computational biologists who come and bring different perspectives, as well as getting out there and speaking with physicians who are treating patients to understand what are the most pressing and important challenges to solve. That people are open-minded and receptive and open to collaborating with others and sharing their latest, greatest ideas, even if they're not working out.
And so how long did it take to work out?
Generally, trying to break down a complex problem into its pieces is important, and to be able to have some successes along the way where you can say, we accomplished this, and then because we accomplished this, now we could accomplish that, and this has opened the door to X, Y, and Z. And so an example of that has been showing that we could profile a patient's tumors routinely from blood, really by showing that the blood gave a comprehensive picture of the genomics within a patient's tumor. We rapidly expanded to profiling dozens of different cancer types and reaching out to different collaborators and trying to understand, not just in our particular areas of focus, but how could that extend to other cancer types.
So Paula, you as the head of a department and someone who's familiar broadly with the whole world of materials and nanoparticles and things, what do you see as the field's challenges in assembling the armamentarium of nanoparticles that are going to have to do the work that we want them to do in the years ahead?
We definitely have several challenges. One of them is actually the ability to penetrate deeply into tissues and to very effectively program nanoparticles or nanomaterials to go only to those tissues or to go highly selectively to those tissues. I think as we begin to understand more about the histology of tumors, the pathology, we can actually design these nanomaterials to more effectively penetrate those tumors and also avoid healthy tissues. We also have to be open to other modes of introduction of our nanomaterials.
So you're sort of scanning the horizon of everything that's going on in biology, saying this result in this paper over here, tell me something about a protein that might bind to a particular cell type but not others. And so you could get a helpful hint from any of 10,000 papers.
Yes.
How do you digest all of this and figure out what to do, what leads to follow?
It is highly overwhelming. It definitely helps to have very curious and engaged graduate students and postdocs in lab who are out there reading along with you, going to symposia, hearing what biologists are talking about, hearing about new discoveries. Hearing others speak gives you ideas about how you can get around a problem. And sometimes it means thinking a little bit differently about things. Instead of thinking always about trying to get to a problem through the same path, you actually realize that there's an easier path, and you learn about it by hearing some of your colleagues speak.
Well, students and postdocs are this amazing intelligence network that knows everything, and I think it drives most fundamental research.
Really
With that in mind, I want to ask Katerina, who is still at this stage of training, where do you want to be 10, 20 years from now?
I kind of find myself trying to bridge this barrier between what we think of in terms of high-tech, cutting-edge, shoot for the moon research happening here at MIT and in Boston, and what the real patient experience looks like, and how we are kind of detached from what that may look like for our fellow neighbors here in the US, in Massachusetts, and not just in India, for example. So I think that that's where I want to be in 20 years. I don't know what hat I will be wearing, possibly not that of a researcher, but I see myself advocating for more kind of back and forth between the places like here and the real experience of the patient.
So innovation doesn't have to mean expensive.
Exactly, or inaccessible.
I'd like to ask all of you about what innovation in something other than what you're working on inspires you.
I'd say genome editing. It's just amazing to think about the possibilities that range from correcting mutations which lead to specific disorders to when we study patients with cancer, if we could correct the genomic aberrations that effectively gave rise to the cancer and that are present in all cancer cells, could we someday reverse and convert those cancer cells back to normal cells? It's just a fascinating idea.
Another modality of immunotherapy that has really, again, talk about delayed gratification, but has been a long time in coming, is the ability to actually engineer T cells. And part of that is using in part, the genome editing technology, but really just a maturation of how we can use molecular biology to actually create designer T cells that can really very effectively and potently go after cancer.
I'm actually excited about some of the technologies that have evolved in protein engineering, which have allowed us...
Tell us about, how does that work?
Essentially, you can design or create designer proteins that can act as therapies, but can also act as targeting agents, fusion peptides, and a range of other therapies. They've played a role in everything, including immunotherapy. They can play a role in designing systems for circulating tumor cell applications. It's actually a series of technologies that has now been advanced and can now be essentially more accessible because several developments have made it cheaper to design proteins in a way that is efficient and allows us to create large amounts of very precise protein.
So in a way, all the things you're talking about are kind of related. It's being able to, swap in and out letters of DNA and swap in and out parts of T cells and swap in and out portions of proteins. It's kind of looking at all these biological pieces like Tinker Toys, where you can assemble them in different ways for different purposes. And you have this whole catalog of things to choose from. And you're limited by your imagination as to how to put them together in different ways, and then your ability to test them efficiently. Because you can't first test them in a human patient. You have to find some way to figure out which of these hundreds of clever ideas you're all talking about.
I think it speaks to the recognition that we all have that cancer is very heterogeneous, that each cancer and each individual of a cancer type will choose the path of least resistance to become resistant. And so I think the onus is on us to figure out how can we best understand what is the vulnerability of that individual. And we're going to need a rather large toolkit so that we can address that challenge.
Absolutely. And Katerina, what excites you? You haven't been in the field for decades and decades.
That's right.
But I presume you're a very active observer of everything that's going on. What other work excites you in innovation in oncology?
Well, I think for me, it's almost taking a small step back and thinking about maybe not even something specific to oncology, but things that may be relevant to diagnosis and treatment in oncology. And I think I have two candidates that I have to decide between.
Tell us all.
So the first one would actually be, all the research happening around the microbiome. I'm very interested in. And I was recently at a friend's defense, and this is defense season, and I learned about his work trying to use simple, bacteria that line our gut or other microbiome-rich areas of the body and turn them into drug-producing factories, which is fascinating because there's a lot of implications downstream from things that may be aberrant and going wrong in the microbiome about how those affect the overall health of the body, and from autoimmune disorders to possibly even cancer. So I think that's going to be fascinating, just to see how we can fix it and how we can maybe use it to produce, for example, drugs.
And your second example?
The second one actually for me would be rapid prototyping and 3D printing and how that may change access to everything, not just medically related tools, but in medicine, for example, access to tools for patients. So it used to be that 3D printing was thought of as this tool to quickly make a prototype and just show it before you go onto the full-blown prototype. But now you can 3D print metal, you can 3D print soft materials. People 3D print scaffolds for tissue engineering. I can totally envision 3D printing a tool, if you don't have it in your clinic, to do some sort of biopsy, 3D printing a chip so that you can immediately test, circulating tumor cells and see what this patient has at the point of care. So I don't know what the future will hold there, but I think it's democratizing access in a way that's fascinating.
What do you do with the vast amounts of data that are getting generated by all these different kind of projects? Something that unites all this innovation.
On the clinical side, cancer centers are, in essence, trying to organize tumor boards to assimilate some of this, what we call precision medicine information, and trying to develop algorithms for treatment. It does require large teams of people, but early far to go.
For the people that I work with, systems biologists who look at different pathways that tumor cells take to survive chemotherapy attack. And one of the things that's important for them is to find biomarkers that actually indicate which patients would respond to which unique set of combinations they've devised. And we work together to try to understand some of these things. One of the challenges is that we can receive data on a larger, broader scale, but for individual patients, sometimes it's more difficult to rapidly find those biomarkers. So we need maybe a little bit more help from technology to essentially scan for these specific biomarkers in some cases, especially depending on where you are geographically, it matters. But we also need to be able to share databases that are the same so that our machines can access this data in the same way.
Being able to take an idea and say, let's look in a clinical trial and let's see, say one that was done previously, do our hypotheses check out? And do these biomarkers that we thought were biomarkers actually predict for how a patient does? And if they do, that those data could set the stage for future prospective trials, and that's where partnering with physicians who are ready to write those protocols and rapidly go from idea and sort of preliminary validation into a prospective approach in patients is really amazing and important.
One missing piece in terms of data is what about other patients outside the US, for example? You'd be surprised to find that, let's take India again, the sheer amount of data that could be harnessed from a massive population, like the Indian population, is impressive. And yet the tools to do so are not there. And that's changing now. But sitting in the same room as clinicians in the cutting edge hospitals there and hearing them talk about organizing databases for their clinical trials to try to systematize the kind of dosing regimens they use for cancer patients, trying to systematize and think about the mutations that their population experiences versus what standards of care are built off of, which is things here in the West, trying to think about how do you both collect that amount of data and how do you make it relevant to treating specifically the patients you are seeing, I think is very important. And I'm excited by the strides being made in that direction, but I was also shocked to find how it was lacking, and it's still lacking, and how we're basically sitting on unexploited information that could be making a very big difference on patients' lives.
Paula?
Yes, actually, Katerina's comment made me think about your earlier question about technology that is really fascinating and is, I think, nascent, which is the ability to develop paper diagnostics that are actually able to detect even the smallest changes, epigenetic changes, DNA and RNA changes, and are now being applied to cancer.
It's pretty exciting to see what you can put on a little piece of paper and take anywhere in the world.
Yeah,
Absolutely.
Before I do that, I want to thank everybody for coming out to listen to this panel and be part of the discussion today. I want to thank everybody who's going to be listening to this as part of the discussion groups with the Biden Cancer Initiative. So I'll ask you to close by giving me one word that captures your feeling about the state of innovation in cancer today. Katerina?
Perhaps amazed.
Victor?
Convergence.
Convergence. Paula?
Exploding.
Exploding. Kathy?
Excited.
Excited. My word is thank you. Thank you to all of you and to everyone and to everybody who's part of this whole initiative. Thanks very much.
Thank you.